Are you familiar with condition codes and modifiers? Did you know that there are specific condition codes and modifiers that are required during the COVID-19 public health emergency? Well, in this video, I'll give you the news you need to know regarding condition codes and modifiers. Stay until the end and I'll give you a little gem that the AMA dropped on Telehealth E services. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified, marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've helped hundreds of students become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Subscribe to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. So before we get too far ahead, let's define some terms. If you have a basic understanding of terms like modifiers, condition codes, etc., it will make it easier to understand the need for the codes we will discuss. So modifiers indicate that a service or procedure performed has been altered by some specific circumstances, but not changed in its definition or code. They are used to add information or change the description of service in order to improve accuracy or specificity. Condition codes are designed to allow the collection of information related to the patient, particular services, service venue, and billing parameters which impact the processing of an institutional claim. Institutional claims are generated for work performed by hospitals, skilled nursing facilities, and other institutions for outpatient and inpatient services, including the use of equipment and supplies, laboratory services, radiology services, and other services. Temporary expansion sites, also known as CMS Hospitals Without Walls, as part of the CMS Hospitals Without Walls initiative, hospitals can provide hospital services and other healthcare facilities and sites not currently considered to be part of a healthcare facility, or set up temporary expansion sites to help address the urgent need to increase capacity to care for patients. CMS is waiving certain requirements under the Medicare conditions of participation. However, hospitals would still be expected to control and oversee the services provided at alternative locations. So let me add, if you are interested in medical coding and would like more information on how to become a certified marketable medical coder, check this out. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. There are several modifiers that are needed to assist CMS and the Medicare Administrative Contractors, or MACs, to pay for services during the COVID-19 public health emergency. The condition codes and many modifiers are not new. However, the guidance and information as to when to use them has been updated for our current public health emergency. The title of the DR condition code is disaster related, and its definition requires it to be used to identify claims that are or may be impacted by specific payer health plan policies related to a national or regional disaster. The descriptor of the CR modifier is catastrophe/disaster related. The CR modifier is used in relation to Part B items and services for both institutional and non-institutional billing. Non-institutional billing are claims submitted by physicians and other suppliers. Use of the DR condition code and CR modifier are mandatory for institutional and non-institutional providers in billing situations related to COVID-19 for any claim for which Medicare payment is conditioned on the presence of a formal waiver. A formal waiver is a waiver of a program requirement that otherwise would apply by statute or regulation. The DR conditional code is used by institutional providers only at the claim level when all of the services or items billed on the claim are related to a COVID-19 waiver. The CR modifier is used by both institutional and non-institutional providers to identify Part B line item services that are related to a COVID-19 waiver. Hospitals should add the DR condition code to inpatient and outpatient claims for patients treated in temporary expansion site during the public health emergency. Similarly, practitioners that furnish covered professional services to Medicare beneficiaries in these temporary expansion sites can bill Medicare for these hospital services. Practitioners should use the applicable place of service code depending on whether the temporary expansion site is being used to furnish outpatient or inpatient care. Also, practitioners should add the modifier CR to professional claims for patients treated in temporary expansion sites during the public health emergency. In this video, we talked about the telehealth and the waivers related to telehealth services. Well, during the public health emergency, the CPT telehealth modifier 95, should be applied to claim lines that describe services furnished via telehealth. So you learned information about condition codes and modifiers. You learned their definitions and their usage during the COVID-19 public health emergency. You also learned whether their use is mandatory or not. Question of the day: are you being provided with this information, and are these updates helpful for you? Let me know in the comments below. Oh, and before I forget, the gem from the AMA. In this video, I talked about the changes that are planned for 2021 in regards to evaluation and management. If you missed that video, check it out. I'll put the link in the description box below. Anyway, in the AMA document, CPT reporting for COVID-19 testing, which I linked below in the description box as well, states that CMS will permit reporting of telehealth E&M office and other outpatient visits based on time and medical decision-making. Look at the AMA and CMS getting providers ready and allowing them to put the new E&M guidelines into practice. Gotta love that fine print. Remember, medical coding is more than reimbursement. Medical coding expands into so many more areas, such as statistics, data analysis, morbidity, and mortality tracking, just to name a few. And these are the areas that we are experiencing every day during this pandemic. And the icing on the cake is that this particular profession is one that can be done remotely. And actually, it's been done remotely for years. So I encourage you, if you are interested in medical coding, get certified and become marketable. There is room for you, and I can help you achieve both. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or a question, and I check them all and I answer them all. Let's stay connected and connect others, shall we? Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.